Hi everybody, welcome to Beyond the Trip. In this episode, I interview Dr. Bill Richards, who is a true pioneer in the psychedelic research space and has been involved in this work from the original research that took place in the 60s up till the present day. He is somebody who I deeply respect and whose work has been very influential on me. His combination of rigorous research skills and deep reverence for the sacredness of these medicines is something that I feel is extremely important for this field. Bill Richards is a senior advisor at Sunstone Therapies and a psychologist at the Center for Psychedelic and Consciousness Research at the Johns Hopkins School of Medicine. He has been involved in psychedelic research since 1963. From 1967 to 1977, he implemented projects with LSD, DPT, MDA, and psilocybin at the Maryland Psychiatric Research Center, including protocols designed to investigate the promise of psychedelics in the treatment of alcoholism, depression, narcotic addiction, and psychological distress associated with terminal cancer. He's one of the leaders in the field at training mental health professionals to work in this space. His book, Sacred Knowledge, Psychedelics and Religious Experiences, has been published by Columbia University Press and translated into multiple languages. In this episode, we discuss the beginnings of his work in psychedelic therapy research, key components of psychedelic therapy, the importance of the therapeutic relationship and the being of the therapist, therapeutic intuition, mystical experiences, coming to terms with death, and the importance of presence in life. I hope that you enjoy this conversation as much as I did. Now let's get into it. Welcome, Bill. It's really fantastic to have you here on this podcast. Thank you so much for taking the time out of your busy day to talk with us in your evening and my morning. When I dreamed up the idea of this podcast, you were one of the first people that I actually thought of wanting to interview, for lots of reasons, actually. You've been a real pioneer in this work, and so it feels a real honor to have you here. You've been working in psychedelic research in different forms since the 60s, which I'm looking forward to hearing about today. And when I trained as a psychedelic-assisted psychotherapist at Monash, your learnings from you and your team, Mary Cosimino and others, were very much a part of our training and underpinned a lot of what we do now. And so we were also lucky to have you as our clinical supervisor at the start of our trial using psilocybin-assisted psychotherapy to treat anxiety disorder. And so it feels like a really natural fit to have you here talking with us about psychedelic-assisted psychotherapy. Welcome, Bill.
Well, it's a real honor to be with you. As you know, I believe in the potential of psychedelic-assisted therapy, and what's happening in Australia is really exciting. And anything I can contribute to get it launched in a safe, responsible, effective way, I'm more than happy to contribute my energies. Yeah.
Great. Thank you. Yeah, and I think something that one of the other reasons I really wanted to have a conversation with you, Bill, in particular, is you've written in your book Sacred Knowledge about the sacredness of these molecules and their potential to create in some people at the right dose mystical experiences, visionary experiences. And I feel like as we move into the clinical use here in Australia, it's really important to also hold that and to talk about that as therapists. So we'll get into that more later, but maybe we can start from the beginning, Bill. I'd love to hear from your end, about where you started in this work. In the 60s, I think I'll let you choose where you want to start, really. So where would you like to begin?
Well, let me jump in at the very beginning, okay? Believe it or not, I was once a 23-year-old graduate student at the University of Göttingen in Germany. And it's hard to believe, but this was in the days where psychedelics were completely legal and not controversial at all. And I hadn't even heard the word psychedelic. I had no idea what psilocybin might be. But two of my friends participated in an interesting experiment in the Nervenklinik, the psychiatric clinic around the corner from my dormitory. And one experienced himself sitting in his father's lap. His father had been killed in World War II, and it was very healing and meaningful to him. And the other saw what he called hallucinations of SS men marching in the streets. And I thought, gee, I've never seen a real hallucination. This sounds kind of interesting. So I went over to the clinic, and the framework was that this new drug was supposed to evoke memories from early childhood. And I thought, well, maybe I'll get some new insight into my Oedipal complex or something. And they asked me if I got drunk very often. I didn't. They led me to a little basement room with a cot and end table, a little narrow window looking out over the hospital garbage cans. And they gave me an injection and left me alone. And I chose to trust, curious about whether any insights about my early childhood would appear. And to my utter amazement, this incredible transcendental state of consciousness opened up that I didn't even know was, I couldn't have imagined it. And I remember the researcher came in to test my knee reflexes. He was hitting my patellar tendon with his little hammer. And I was sitting there with outstretched arms, feeling compassion for the infancy of science, that they had no idea of the magnitude of what was going on. The assumption then was that high doses of psychedelics made people psychotic, so you'd only give low doses. And for some reason, this low dose was a high dose for me. So at the end, I said, and what was the name of that drug you gave me? Psilocybin. How do you spell it? What is it? And the rest of my life, in many ways, is footnotes to that experience. So I became known as that interesting American who had the mystical experience. And then I started guiding English-speaking people through sessions in the clinic who wanted a legal experience, as it was still legal in Germany, And I've been guiding sessions ever since. So anyway,
that's right.
Then I worked in various locations, Maryland Psychiatric Research Center for 10 years, till the research became dormant in 1977. And then 22 years of dormancy, and then Roland Griffiths and I were able to start research at Hopkins, which has now gone from a staff of 3, Roland, who has recently died, and Mary Casamano and myself, to now a staff of over 60, which is quite amazing. And I'm also working at Sunstone Therapies, specializing in palliative care with psilocybin. So life is quite promising at this point.
Yes, it must feel like a really interesting space and a beautiful space to find yourself in doing this work and seeing it kind of open up in such a way over the last
like 20 years after those years of not being able to do it
That's right.
legally. It was 22, was it 22 years that you said that you had to
Yeah,
stop your research?
of total dormancy. Yeah, I
Yeah.
remember in around 1970 when we moved into this beautiful new research facility for psychedelics, the Maryland Psychiatric Research Center. Everything you could dream of, you know, specially designed psychedelic treatment suites with private bathrooms and kitchenettes and biochemistry labs and sensory isolation rooms and auditorium and library, animal research, you
Mm,
name it, 4 stories. And we were sitting around a table wondering how we would
mm,
train the hordes of therapists that would be needed in a few years to implement this therapy. And then all of a sudden, the whole thing closed down. And I remember emptying out my office in 1977 with my two little boys, who were 1 and 3 at that
mm.
time.
Wow.
And it looked like psychedelic research was over,
Yeah. And
It's great to have experienced the rebirth of it.
absolutely. Yeah. And speaking of kind of training, like I said earlier, a lot of the learnings from your work over the years, both the first period and when you joined with Roland Griffiths and the rest of their team in the second, have really like been the foundation of my training as a psychedelic assisted psychotherapist and a lot of other people. What are your learnings from that time around how to really safely guide people through this work? You're one of the most experienced people in the world at doing that. So as we kind of move into clinical use in Australia, yeah, there's lots of ways you could take this question, but what are the most important things that you think therapists who are listening to this should be thinking about when they are learning this work?
Well, clearly, as I hope everyone knows now, there's much more involved in the action of the molecule. And you don't just throw the molecule in your drug and have a good experience. It's not that kind of drug. The psychedelic, I like to think of it as it unlocks a door, it gives an opportunity. But what you do with that opportunity depends on your preparation, the quality of the relationship, how safe and secure you feel, and whether you can choose to dive into your mind, even if it looks scary,
Mm,
you know, to receive whatever your own mind choreographs on that particular day with that particular dose of a psychedelic
yes.
just for you, and to be willing to learn from the
Mm,
experience. You may know that they call the mushroom psilocybin cubensis, for example, the golden teacher.
mm,
And the idea is that the experience teaches you something, and you go in as the humble student, and it might be a painful
yeah.
lesson. You know, if you all of a sudden are reliving repressed grief
Yeah.
from 2 decades ago, that's not a bad
No.
trip. That's intensive psychotherapy,
Yeah.
you know? But you have to be willing to go through that,
Yeah. Yeah.
or whatever it is. And I've come to deeply believe in what I call the wisdom of, or the entelechy, the meaningful unfolding of
Beautiful.
content of the interpersonally grounded psyche.
Mm,
Okay. When you're in a relationship where you feel safe, that everything is welcome, there's no need to run away from anything, censor anything.
mm,
Uh, you're curious, you're open,
mm.
and you'll receive whatever your own mind presents.
Yeah.
When that is in place, the experience is almost guaranteed to be beneficial.
Yeah.
And it sure helps to have a wise choice of music and a nice environment that feels safe and comfortable and so on.
Yeah, absolutely. And
We're learning.
absolutely.
We're still learning. And I like to stress that we're not just learning about the drug, we're learning from each person that we give it to, that the patient, the participant in the research, is also a teacher. And we're in the world together beside one another. Okay? It's not that I'm the wise doctor that has all the answers and you're the screwed up, confused patient, and I'm going to fix you, doesn't work that
Yeah.
way. It's like we are in the world beside each other. I will ensure your safety and prepare you well and give you structure and guidance if you need it. And if you don't need it, I won't interfere. Okay. I'll be sensitively present
Yeah.
with you. And when we're together, it's like there's no one in the world except the
Yeah.
two of us. I'm not going to play with my iPhone. Okay. I'm going to really be present, just in a meditative state, especially during the onset and ascent periods of the psilocybin response or whatever the drug happens to be.
Yeah.
And that's an art. It's the being of the therapist as well as the theoretical knowledge that's very important.
Yeah. I think that there's so much in what you just said I could unpack, but I think I'm really struck by that's the being of the therapist. And it sounds kind of, to maybe an outside person to be kind of simple. You just be present. But actually, when you're in the room with someone as a therapist supporting them, we're still working in dyads. So there's usually two of us. You're doing a whole lot. You're tracking, I'm tracking my body to see what's coming up in me. I'm tracking the participant or the client to see how their body is moving, just to kind of keep really present with them and their experience. I'm often checking in with my diet partner non-verbally every now and then to see if they're having any thoughts about wanting to check in or not. And I think that is a real balance of knowing when to let someone kind of flow through their experience and when to intervene and see if they're okay. Sometimes it's very obvious that they need some intervention, and other times you're kind of working with your intuitive sense therapist, right?
Sure. That's right. And it's so important that the therapist doesn't think of the psychedelic experience, but comprehends that there are many different strata of experiencing during the action of psychedelics. And that body on the couch or the bed may look the same throughout the day, but what's going on in that mind may be anything from a newborn child to a confused adolescent to a adult making decisions to a enlightened master to a very scared person, and you have to kind of intuitively tune in to where that person is. And there are times where if the person's mind is in transcendental mode, if you will, there may not even be a person to talk to
Yes.
there. There's a unitive consciousness prevailing in
Yeah.
that body. And if you ask that person to talk, you're really asking them to fight the experience, okay, to reconstitute the everyday personality, get enough air in the lungs, activate the voice apparatus, and avoid what's
Yeah.
emerging to speak to you. So there's times where you opt for silence because all is going well. And other times where you just feel, yeah, I always say, would you like to describe where you find yourself?
I love
And it's always an invitation, never a demand. Okay.
yes.
But that's part of the value of experiential learning, for therapists to be able to have their own psychedelic experiences. Uh, they can happen spontaneously without psychedelics, but that's not terribly common, you know? Sometimes people glimpse these deep transcendental realms in meditation or natural childbirth or creative fervor of one kind or another, you know, sensory isolation or overload, whatever. But it's hard to imagine them if you haven't experienced them yourself. You know?
Yeah, absolutely. We were very fortunate at Monash, as you know, to have a self experience that was part of a research trial as part of our training. And I think it was so, so helpful. All of our participants said that we spoke to about it, which we because it enables you to share as well, not only to get kind of a felt sense of what it's really like to have a psychedelic experience, but also what it's really like to be vulnerable and to put yourself in the hands of
That's
therapists
right.
in that setting. And it a lot of the people we worked with had not had a psychedelic before, and so it allowed us to say, yeah, we've lain on that couch, we've gone into those places, never the same as where you're going to go, but we know a little bit what it's like.
Mm-hmm.
I have a question. So you trained with originally, I know with Abraham Maslow. And a lot of people listening to this podcast would be therapists or trainee therapists. So, what kind of, in terms of, as well as not just the dosing, but in the preparation sessions and the integration sessions, are there particular models of therapy that you draw on or that you use that you find helpful?
Yeah, well, I feel there's two important things that have to happen before we give someone a psychedelic. And one is establishing the relationship of a basic sense of safety and trust. And if we can't establish that, we shouldn't give them the drug. Okay. You know,
Yeah,
that's, and
yeah,
that's the skill, the art of the effective therapist, to establish a really deep sense of trust with a variety of people in a very short period of time. You know, it's, you have to trust.
yeah,
I think every dyad of patient and therapist, if you will, is unique. And, you know, there's no one size fits all,
yeah,
but you just sense with this particular person, how can I create this envelope of safety and openness and trust? You know, some people
yeah,
need more self disclosure than others, you know,
yeah.
etc. But once that's established, then there's, I think I call it psychoeducation.
Mm,
People need to be taught how to respond to the action of a psychedelic. Just as if you were going to go skiing or scuba diving for the first time, you should have some lessons, some knowledge, you know, to do it safely and productively. And the essence of that is, first of all, trust, let go, be open, receive whatever your own mind presents, dive into it like diving into a swimming pool. Okay. whether it's exciting or boring or scary or beautiful or comprehensible or incomprehensible, accept it, explore it, be curious about it, choose to trust. It's not just being passive to see what will happen. It's diving off the high dive into the water when you don't know the depth or the temperature, but you know that others have done it and you got a good lifeguard beside you. Okay.
Yeah,
But
absolutely.
it takes some courage, Yeah.
Totally.
And a real decision. And so if there's a monster that appears, what do? Obviously, you dive into his eyeball. You say, my gosh, are you ever big and scary? Why are you here? What can I learn from you? What are you made up of? Okay. You're my very own monster. Okay.
Yeah.
I'm not going to just run from it and take the eye shade off and go to the bathroom. Okay. I'm going to find out what this is all about. So there's that intention to confront, explore. You may know in the ayahuasca religions, there's this wonderful tradition with the giant anaconda serpent. What you do if you see the anaconda? Well, obviously, you dive into his mouth and look out through his eyes. You become your Kundalini, your Shakti, your Elan Vital. You don't run away from it. And if you run away from it, you know what's going to happen. Panic and paranoia every time. You get smaller, it gets bigger, and you have the nightmare sequence. Okay?
Absolutely.
It's not helpful.
Yeah.
So, number one, to confront, to receive whatever emerges, even if it's exquisitely beautiful, dive into that too. Receive it. And then the next big principle, I know you know this, you tell this to your own patients, but it's to turn off the rational mind, the intellect. Especially those of us who went through graduate school, there's this tendency to say, stop the world. What's going on here? I got to figure it out. I got to label it, No, let the intellect go out and play for 6 hours while the experience happens. And you collect intuitive experiences. And the way you bribe the intellect is you tell it, when you come back in at the end of the day, I'm going to give you all these new experiences to think about. And you can play with them and categorize them. And you can draw on your knowledge of depth psychology and quantum physics and philosophy and religion. You can label it any way you want. But while it's happening, intellect, you go out and play. This is an intuitive experience, not a cognitive, rational experience.
Yeah.
Okay.
I think.
And this goes way back to in the psychology of religion, as it does Heilige, Rudolf Otto, 3 modes. There's the rational, there's the irrational, but then there's the non-rational or the intuitive. And that's where the psychedelic realm opens up.
Yes.
We have to take that seriously. Yeah. Okay. And then what else would I want to teach? Somatic expressions.
Yeah.
And that's your area of expertise too. That if there's a tremor or nausea or whatever, you don't just complain about it as a nasty side effect. You explore it, you dive into it, you find out if there's memories or thoughts or meaningful content connected to it, And at any time, you can reach out for the hand of
Yeah.
your therapist, either for sharing reassurance or just for support. Because, boy, I'm going places I've never been before. This is exciting, but it's scary, you know? And as you know, often
Yeah,
people
totally.
really do feel that they're dying or they're going crazy. And you say, no, if you feel like you're
Yeah.
dying, go ahead and die. You'll be okay. Trust, let go, be open, accept.
Yeah, totally. I
And
think I actually I relate in my own experience to I mean I'm a somatically trained psychotherapist and psychologist, and I use somatic psychotherapy principles and internal family systems a lot in the psychedelic work that I do. In my experience, I had a really strong stomach pain when I did my self experience, and I really wanted to avoid the stomach pain. So I sat up, and my therapy partner was my therapist that day, and he said, maybe that's something you should go into. And so I did. And I had a really beautiful transformative image of myself in a garden with all of the women in my family around me. And I was kind of standing there, and there was nature kind of moving out of my body, and it was quite a stunning visual experience that really connected to my intention around kind of working with some grief around being living in a different country to my family. And
Mhm.
so that was a very personal experience. And even though I have all of the cognitive knowledge, my cognitive brain wasn't on, thank goodness, which is always challenging. Definitely for people that went to grad school or that like to think our way out of things, right? It was hard, but um, I needed that encouragement from my two therapists on that day to go towards. And I think that's the really important job that a psychedelic assisted psychotherapist does. On dose day, they're really helping someone to go towards something that's scary and just providing that safe, trusting relationship. And that takes different amounts of time for different people too. And I think one of the things I'm excited about in Australia is we can tailor things much more now that we're working outside of research trials too, which is great.
Yeah, you're very lucky. But we got to use that opportunity wisely. Yeah. Just recalling how at the Spring Grove Hospital and Maryland Psychiatric Research Center, when we would hire a new therapist, even an assistant, a psychiatric nurse or a practical nurse who would be a co-guide, uh, we would always offer 2 LSD experiences as part of on-the-job training.
Amazing.
And they were paid for those days.
Yeah,
That was before the days of institutional review boards and so on. But it was perfect. It was reported to the FDA. There was nothing controversial about it. It's like, if you're going to do this, you need to comprehend uh, something of the vast realms within the human mind, you know, so you can stay centered and present and not start to panic and just wonder where the emergency meds are located.
totally. Um, I that brings me to a question that I really want to ask you, actually, um, which is, in all of the research trials and in many different research trials in different spaces, it's been shown that mystical experiences have been correlated with positive outcomes for people. Why do you think that is? And I know no one has exactly the answer, but what do you think that is about for people?
Yeah, well, I'm happy to talk about that. Uh, as you may know, I do have a background in the psychology of religion as well as clinical psychology. So
Yeah,
I love to put on both hats here. Um, yeah, these mystical, transcendental choose your word, experiences are incredibly beautiful, incredibly profound, and they don't always happen, especially in a first session. And they're not the only things that are helpful. You can spend the whole session working through relationships in your early childhood, and that can be very valuable. But we wouldn't call it mystical, or
Yeah.
religious. But the mystical forms of experience entail this sense of uh, a unitive consciousness outside of time and space, intuitive knowledge, incredible beauty, meaning, love, joy. I mean, they're wonderful. Even though it's hard to talk about them because, in a sense, you weren't there when they happened. Like there's a sense of the everyday personality dying or fading out and then being reborn. But when you're reborn, in your memory, there's this memory of this eternal state, and it stays with you afterwards. Okay. Now, people who have that type of experience often show the most dramatic uh, responses and decreases of depression and anxiety, and with cancer patients, fear of death, for example, and openness to live in the present fully and enjoy interpersonal relationships and all that good stuff. Um, so it's not just that it feels impressive, but it has what William James called fruits afterwards, that people do view themselves and other people in the world in a fresh way afterwards.
Yeah.
It still has to be more fully integrated for many people. Um, but these experiences are incredibly powerful therapeutically.
Yeah.
And it's important that the therapist appreciate that and not just say, boy, he was really out of it.
Yes.
He was out of time and space, but his consciousness was someplace else beyond space. One of the core mystical insights, this sounds incredibly poetic. It's hard to believe if you haven't been there, but it's at the very core of the mind, of the core of reality, the origin of consciousness, whatever you want to try to call it. There's an energy, a creative energy called love. And love is more than just a mushy human emotion. It's an intelligent, healing energy. Okay? It may be the most real thing there is. You may know Dante in the Divine Comedy at the very last line says, "It is love that moves the sun and other stars." I think he was writing out of his own experience. I don't know if he took psychedelics or ate moldy bread or just was a spontaneous mystic like Abe Maslow.
Yeah. Yeah.
But there are people who have these experiences and write out of them and express them,
Yeah.
including people like Einstein and Eleanor Roosevelt.
Yeah. 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 I think I really love what you just said about love and being an intelligent healing force. I think yeah, it's such a beautiful and important thing to remember in this world right now to kind of remember that.
And you're right. And to try to we try to avoid religious language in medicine, although medicine and religion in in the past have often been very interrelated, you know. Um,
Yeah.
but when you experience that sense of love, being totally accepted, accepting acceptance in the language of Paul Tillich, the theologian,
Mm.
uh, your view, there's nothing um, you've done or experienced that can't be healed. You know, there's no relationship that you can't address in a fresh way. You
Mm.
know,
Yeah.
it really changes your view of who you are
Yeah.
and what you're capable of. You for the addict, think of the typical addict who has lost jobs and relationships and perhaps even teeth, you know,
Yeah.
and feels so worthless, you know,
Mm.
failure. If that person can discover this mystical dimension,
Mm.
afterwards he or she will say, well, I know there are incredibly strong, beautiful inner resources in my mind. You know, there I do have worth,
Yeah.
you know. There, you know, staying sober may be a challenge, but you know, I can do that, you know,
Mm. Yeah.
because the
Absolutely.
whole sense of who I am has
Yeah.
changed. That's why this therapy is so incredibly powerful.
Absolutely. Yeah. And I think, I mean, I could go down so many different tracks here, but um, what do you like? How do you advise people, perhaps who haven't had a mystical experience, who are working therapeutically with a client who has, how to support that client well? I have my own kind of thoughts, and because not everyone has a mystical experience when they have a psychedelic experience. So even if therapists have had that as
That's
part of
right.
the training, they might not have been, and the chances are they haven't been to the particular version of the person in front of them. So, what advice do you have for those people on how to be with that person in the integration phase after the experience?
Yeah, you have for both in preparation during the session and in integration. The therapist has to be able to be present, respectful, appreciative. You know, uh, maybe curious, but not threatened. You know,
Mm.
if the therapist thinks that any state of consciousness other than our normal one in everyday life is mentally ill or psychotic, that person would not be a good psychedelic therapist. Okay? Because there
Yeah,
are other states of consciousness that may be atypical, but they're incredibly interesting and healing and perhaps healthy, you know?
mm,
So you have to be able to not get frightened yourself, because if you, as the therapist, start getting tense, worried, frightened, that's contagious. And the patient
yeah,
will start to feel that tension, you know?
totally.
You
Yeah,
have to be able to genuinely be centered and real and present. And that grows through experience, you know? Uh, but, you know, in terms of thinking of who to hire to do this, it occurs to me I would like to hire people who have lived fully, you know, who have taken some risks, who have maybe experienced some grief and guilt and struggle and suffering in life,
yeah,
you know, not someone who's been pampered all the time, you
yeah,
know, they make good therapists.
totally.
Yeah,
I know what
they're
you mean.
real.
Yeah, yeah.
Yeah,
Thank you, Bill. That's really important for us to, it's definitely something that's been on my mind a lot as we move into this work in Australia. What kind of therapists or people do we want to be recruiting? And I have one final question, because we're coming to the end of our time together, and I really want to ask you, just, it's a slightly more personal question, I guess, or the intersection between personal and professional. You spent a lot of time in your career working in palliative care with people who are dying. What has that work taught you about living?
Well, many of the people I have worked with in palliative care with LSD or DPT or psilocybin or MDMA have had incredibly meaningful experiences. And afterwards, they often report loss of a fear of death, but they don't manifest suicidality. Rather, the present moment opens up and they live more fully. They interact. They may say, well, the pain is still there, but it doesn't bother me like before, you know? And sometimes there's significantly less pain. But they're living. They're thankful for each day they're given. And frankly, my impression is that some of them may well be living longer as well, because their immune systems are functioning better. They're engaged in life instead of the stereotype is lying in bed with the curtains drawn, waiting for the next dose of morphine, not wanting anyone to see me this way, preoccupied with pain, depressed, anxious. That's no fun. Most of us are mortal, and maybe we can come to terms with death just as we have with sex. Sex used to be a total taboo. Now we have pretty healthy attitudes towards it. And maybe the same thing can happen with death.
I hope so.
And the psychedelics will help us in that.
Yeah.
Thank
you, Bill. That's such a beautiful question to close on. I was just listening to Roland Griffith's interview with Tim Ferriss on his podcast, and just before he died, and I was really moved by actually, and that he spoke a lot about that, like kind of being in the present moment and allowing the present moment to really open up. So, and I'll put some links.
Yeah. Classic existential theory is that if you are always ruminating about the past and worried about the future, the present moment sneaks by unnoticed. And then you feel you've only existed, you've never really lived. Okay? That life takes place in the present moment, here and now, today. And if your dominant focus is here and now, and you're enjoying the taste of your food and visiting with your friends and maybe planning a trip to Europe or somewhere, why not? Live. The theme with our cancer patients is that I want to live until I die.
Beautiful.
And they're doing a great job of it.
May we all do a great job of it, Bill.
Thank you for all you're doing. And to all who listen to this tape, I send you my best wishes and become the most effective psychedelic therapist you can.
Thank you, Bill.
One way to do that is to live fully yourself.
Absolutely. Thank you so much.